question here, when assessing or assessment a client for the risks of hyperphosphatemia. So the key word here, hyperphosphatemia, right? They said which piece of information is the most important for the nurse to obtain. So hyperphosphatemia is an electrolyte disturbance which abnormally elevated the level of phosphate are present, right, in the blood, high phosphate. So they said history of the radiation, treatment in the neck region, any history of the recent orthopedic surgery. Orthopedic surgery or orthopedics is the branch of surgery concerned with the condition involved in the musculoskeletal system. Number C, history of the minimal physical activities. And number D said a history of the client's food intake. So the correct answer is the history of the radiation treatment in the neck region. Answer A is correct. Because radiation to the neck might have damaged the parathyroid gland, which are located in the thyroid glands and interfere with calcium and phosphorus regulation. And patient develop hyperphosphatemia. Answer B, any history of recent orthopedic surgery. B has no significance to this case. Answer C, history of minimal physical activity. And answer D, the history of the client food intake are more related to calcium only, not to the phosphorus regulation. So this question said the nurse on 3 to 11 shift and assessment the chart the client with a abdominal aneurysm. So this is the keyword, abdominal aneurysm. Abdominal aneurysm occur basically abdominal aorta. And this is the part of the aorta between the bottom of the chest and the pelvis, right? And an abdominal aneurysm usually causes a balloon-like swelling. Why? If abdominal aorta wall is weaker, right, or thin, it is basically a bulge in the lower part of aorta. And aorta is the largest blood vessel what is running from heart through the chest and abdomen. Unfortunately, patient develop abdominal aneurysm and schedule for surgical repair and surgery in the morning, and nurse finds that the consent form has been signed, right? So basically, when you work as an RN, it is your responsibility to check the patient signed on the consent form or not, right? You are the witness. If you ask me what is consent form or informed consent, it is actually permission granted in the knowledge of the possible consequence, or typically that which is given by a patient to the doctor for the treatment with the full knowledge of the possible risks and benefit of any kind of surgical operation. So here, but the client is unclear about the surgery and possible complication. Like I am your patient. I signed in the form, but I do not know about the surgical benefit or possible risk factor or complication. So which is the most appropriate action? Number A, call the surgeon and ask him or her to see the client clarify the information. Number B, explain the procedure and complication to the client again. So re-education, right? So it is my responsibility as the RN. If my patient do not understand, I will re-educate them. So what else? So what next? Number C, check the physician's progress note to see if understanding has been documented. And number D, check with the client family to see if they understand the procedure fully. So the correct answer is number A. So call the surgeon and ask him or her to see the client to clarify the information. So why answer A is correct? It is the responsibility of the physician to explain and clarify the procedure to the client. Let me recap it. As I told you, it is the responsibility of the physician to explain and clarify the procedure to the client. So what are the RN roles? I want to make sure patients sign it. I will make sure patient understand the risks and possible complication or benefit, and I will be the witness. So the nurse should call the surgeon to explain the client. Answer B, C, and D are incorrect because they are not within the nurse's responsibilities. Next, the nurse is preparing a client for surgery. Which items is the most important to remove before sending the client to the surgery? Number A, hearing aid. B, contact lenses. C, wedding ring. And D, artificial eye. So correct answer is contact lens. Which is the most important to remove before sending the client to the surgical room or OT? Correct answer is said contact lenses. Contact lens, it is the most important to remove the contact lens because leaving them in can lead to corneal dryness, or particularly with the contact lenses that are not extended water lenses. So living in the hearing aid or artificial eye will not harm to the client. Leaving the wedding ring on is also allowed. Usually the ring is covered with a tape. Therefore, answer A, answer C, and answer D are incorrect. What else? Next here, a client is 2 days post-operative colon resection. After coughing episode, the client's wound eviscerated. Which nursing action is the most appropriate? So here, A, reinsert the protruding organ and covered with 4x4 size gauze, and B, cover the wound with a sterile 4x4 and ABD dressing, and C, cover the wound with a sterile saline soaked dressing, and D, apply abdominal binder and manual pressure to the ulcer. So the correct answer is answer C, cover the wound with a sterile saline soaked dressing. But here I want to tell you, my patient is a 2 days post-operative colon resection, right? So particularly colon resection we do in case of any kind of colon cancer. Is the indication of colon resection, right? So colon resection are performed to treat and prevent the diseases and condition that affect the colon. Like example, colon cancer, right? Maybe benign or malignant or critical condition, we do it. And they said after cuffing episode, the client wound AB suggested or wound dehiscence. Wound AB suggestion is the protrusion of the internal organ through the incision. And AB suggestion is very uncommon, but very severe surgical complication. And it is an emergency and should be treated immediately. But wound dehiscence is a surgical complication in which a wound rupture along the surgical incision. But wound abscession, protrusion of the internal organ through the incision. Correct answer is cover the wound with a sterile saline soaked. If the client evisceration, the abdominal content should be covered with a sterile saline soaked dressing. Reinserting the content should not be the action and will require that the client return to the surgery. Thus, answer A is incorrect. Answer B or answer D are incorrect because they not appropriate to these cases. What next? The nurse is caring for a client with a malignancies. The classification of primary tumor is TIS. The nurse should plan care for a tumor A that cannot be assessed, B that is in situ, and C with increasing the lymph node involvement, and D with distant metastasis. So the correct answer, that is in situ. So the cancer in situ or situ means that the cancer is still localized to the primary site. It does not metastasize to the other organ. So here I said TIS. T stands for the tumor and IS stand for in situ. So it is here IS means in, S stand for situ. So T stand for cancer. So cancer in situ. cancer is graded in terms of tumor, grade, or lymph node involvement and metastasis. So answer A, C, and D are not an answer. The correct answer is the B. So the next here. So here a client with a cancer and is undergo to the intravenous pyelogram, the nurse should do what? So here the keyword is the intravenous pyelogram. Pyelogram, it is the X-ray techniques for producing an image of the renal pelvis or urinary tract by introducing of the radio opaque fluid, also called urography, right? Or pyelogram or pyelography. So by this image technique, you can see the kidney, renal pelvis, ureter, and urinary bladder, if any kind of obstruction is there or not, or any kind of pathology. So this number one said, force fluid 24 hours before the procedure. Number B, ask the client to void immediately before study. Number C, hold medication that affect the central nervous system for 24-hour pre and post test. Number D, cover the client reproductive organ with a X-ray shed. So what is the correct answer for this question? It is B, ask the client to void immediately before the study. Why? A full bladder or bowel can obscure the visualization of the kidney, ureter, and urethra. So it is good to make it empty. Answer A is incorrect because there is no need to force the fluid before the test. Answer C is incorrect because there is no need to withdraw medication for 12 hours before the test. Answer D is incorrect because the client reproductive organ should not be covered. What else? Next, a client arrives to the emergency room with possible fractured femur. The nurse should anticipate the order for what? Fractured femur here. It is so the femur or thigh bones is the proximal bones that is the behind the limb. So if this bones is broken, right? So fracture femur, the chance of femoral artery rupture, very important, because the femoral fracture is a fracture of the femur, and femoral shaped fracture is defined as the fracture of the diaphysis occurred between the 5 centimeter distal to the lesser trochanter, whatever it is. Key point is the fracture femur. So femoral artery chance to rupture. So what should be the ideal position? Number A said Tendelberg position. So Tendelberg position, usually the body is lean supine or flat on the back on a 15 to 30 degree inclined with the feet elevated above the head. Number B, eyes to the entire extremity. Number C, bucks traction. So it is the one kind of traction, right? Traction means traction is a set of mechanism for strengthening of the broken bones or relieve the pressure on the supine or skeletal system. So there are two types of traction we use: skin traction or skeletal traction. Number D, abduction in pillows. So correct answer is the bucks traction, number C. So the client with a fractured femur will be placed in a bucks traction to release the leg and decrease the spasm and pain. The tender bar position is the wrong position for this client who have a fractured femur. So answer A is not correct or incorrect. Ice might be ordered after the repair, but not for the entire extremity. So answer B is incorrect. The abduction below is ordered after total hip replacement, not for the fractured femur. Therefore, answer D is incorrect. What next? The nurse is performing assessment on a client with possible pernicious anemia, right? So which data should support the diagnosis? Number A, weight loss of 10 pounds in 2 weeks. Number B, complaint of numbness and tingling to the extremity. Number C, red, refit tongue. Number D, hemoglobin level 12 gram per dl. So the correct answer is red and beefy tongue. Why? A red and beefy tongue is the characteristics of the client with pernicious anemia. Answer A means weight loss of 10 pounds in 2 weeks is abnormal, but it is not seen in pernicious anemia. Or numbness, number B, numbness or tingling sensation in answer B can be associated with pernicious anemia, but are not particular to pernicious anemia. And this is more likely associated with peripheral vascular disease, numbness and tingling, right? Because it is involving vasculature, artery and vein. Answer D, hemoglobin is normal and does not support to the diagnosis. What else? So a client with suspected renal disease is to undergo renal biopsy. So patient has a renal problem or renal disease like glomerulonephritis, and doctor prescribed for renal biopsy to make sure or confirm the diagnosis. The nurse planned to include which statement in the teaching plan? Number A, you will be sitting for the examination procedure. Number B, portions of the procedure will cause the pain or discomfort. Number C, you will be asleep during the procedure. Number D, you will not be able to drink fluid 24 hours following the study. They said nursing plan include which statement of teaching session? Correct answer is B, means the portion of the procedure will cause pain and discomfort. So why number B is answer? Because portion of the exam are painful, especially when the sample is being drawn. So this should be included in the session with the client. Answer A is incorrect because the client will not be position prone. Should be position prone position, not sitting. Right? Anesthesia is not commonly given before this test. So making answer C is incorrect. You will sleep. No, because no anesthesia. Answer D is incorrect because the client can eat and drink following the test. What else? Here, the nurse is caring for a client and scheduled for surgical repair, right, of abdominal aortic aneurysm. Which assessment is most crucial during pre-operative period? Number A, assessment the client level of anxiety. Number B, evaluation of the client exercise tolerance. Number C, identification of peripheral pulses. Number D, assessment of bowel sound and activities. So correct answer is number C, identification of peripheral pulses. Why number C is answer? The assessment that is the most crucial, essential, or important to the client is the identification of the peripheral pulses, because the aorta is clamped during the surgical operation. And this decreases the blood circulation to the kidney and lower extremities. So I will check the peripheral pulses. The nurse must also assessment for the return of circulation to the extremities. So also I need to palpate the peripheral pulses. Answer A is of the less or least concerned. Anxiety is very common before surgical operation. And answer B is not advised at this time. Evaluate the client exercise tolerance. And answer D is the least concerned as well. Assessment of bowel sound.